Greetings. Today, I'm going to discuss what is peptide therapy and when is it used. Peptide therapy has rapidly gained attention in the fields of regenerative medicine, hormone health, and anti-aging. Once limited to laboratory research, peptides are now being used by clinicians to help patients improve metabolism, recovery, skin health, and hormone balance. But what exactly is peptide therapy and when is it appropriate to use it? Let's explore what peptide therapy involves, how it works, and which conditions it may help manage. If we haven't met already, I'm the digital avatar of Dr. Max McLeod, aka the Nutrition Ninja Doc, founder of MyBodySymphony.com and ARTC.health. While he continues to research and explore new and better ways to help his patients achieve their health, performance, and appearance goals, I'm here to convey his knowledge and insights about health, healing, and regeneration. Doc Max believes in using technology constructively to improve efficiency and results. That's why he uses this AI-generated avatar to educate and inform. Before we get into it, please leave a like on this video if you find it helpful. And if you haven't already done so, please hit that subscribe button because it goes a long way toward helping spread these health-related presentations to more people. Peptide therapy involves the medical use of specific chains of amino acids, peptides, to stimulate or regulate natural biological processes. Because peptides are smaller than full-size proteins, they can easily interact with cellular receptors and trigger targeted responses. Each peptide has a unique sequence that determines its function. Some enhance hormone release, others repair tissue, improve immune function, or influence metabolism, unlike synthetic drugs that often affect multiple systems at once. Peptides are highly selective, making them a powerful tool for precision medicine. Peptides act as messenger molecules, sending biochemical signals to cells or glands to initiate specific actions. Here's how it generally works. Administration. Peptides are commonly delivered through subcutaneous injections, nasal sprays, or topical creams. Cellular signaling. Once in the bloodstream, they bind to receptors on target cells, like those in the pituitary gland, muscles, or skin. Response activation. This triggers a cascade of biological reactions, such as the release of growth hormone, collagen synthesis, or fat metabolism. Natural regulation. Unlike direct hormone replacement, peptides usually work with the body's feedback loops, maintaining balance rather than forcing production. This makes peptide therapy adaptive and safer, especially compared to synthetic hormones or performance enhancers. There are hundreds of therapeutic peptides, but here are some of the most widely used in clinical and wellness settings. 1. Growth hormone-releasing peptides, GHRPs. Examples, GHRP2, GHRP6, ipamorelin. Stimulate the pituitary gland to naturally release growth hormone, used to enhance recovery, muscle repair, fat metabolism, and energy. 2. Collagen-stimulating peptides. Examples, ghk-cu, copper peptide, palmitoyl penapeptide promotes skin rejuvenation, wound healing, and hair growth. Common in dermatology and anti-aging treatments. 3. Metabolic and weight management peptides. Examples, AOD 9604, MOTSSC, support fat loss and mitochondrial health. May improve insulin sensitivity and energy balance. 4. Cognitive and neuroprotective peptides. Examples, Selank, CMAX, enhance focus, reduce anxiety, and support brain resilience under stress, being explored for neurodegenerative and mood disorders. 5. Immune and repair peptides. Examples, thymosin alpha-1, TA1, BPC-157. Strengthen immune function and accelerate recovery from injuries, used in autoimmune, inflammatory, or tissue repair applications. Peptide therapy can be tailored to a range of goals depending on the individual's age, hormone levels, and health needs. Common uses include 1. Hormone optimization. For adults experiencing low energy, poor sleep, or reduced libido due to hormonal decline, peptides can help stimulate natural hormone production rather than replace it directly. 2. Anti-aging and aesthetic health. Peptides like ghk-cu and CJC-1295 promote collagen synthesis, improve skin elasticity, and support cellular repair, making them popular in anti-aging protocols. 3. Athletic performance and recovery. By enhancing tissue regeneration, oxygen utilization, and fat metabolism, peptides are used by athletes and active individuals to improve endurance, recovery, and muscle growth. 4. Injury and post-surgical healing. Repair peptides such as BPC-157 can accelerate wound healing, reduce inflammation, and strengthen tendons and ligaments. 5. Cognitive and mood enhancement. Neuroactive peptides like Selank can reduce stress and anxiety, while others improve focus and mental clarity without addictive properties. 6. Immune support and inflammation control. Thymosin alpha-1 and other immune-modulating peptides help rebalance immune response, offering potential benefits for autoimmune or chronic inflammatory conditions. Targeted action works only where needed, reducing systemic side effects. Natural stimulation enhances the body's own pathways rather than overriding them. Versatility can support multiple systems: endocrine, musculoskeletal, neurological, and more. Customization. Therapy plans can be individualized based on lab results and goals. When administered correctly, many people report improved energy, better recovery, enhanced mood, and overall vitality within weeks. While generally well tolerated, peptide therapy is not risk-free. Potential side effects may include mild irritation at the injection site, water retention, headache or fatigue, rare. Hormonal fluctuations if misused. Peptides should always be prescribed and monitored by a licensed healthcare provider, ideally one experienced in hormone and peptide medicine. Buying unverified peptides online or using untested combinations can lead to contamination or dosing errors. In the United States, only certain peptides like sermorelin or thymosin alpha-1 are FDA approved for medical use. Others are available through compounding pharmacies under prescription. Peptides not approved for human use are research grade only, meaning they're legal for laboratory use but not for self-administration. Additionally, athletes should note that many performance-enhancing peptides are banned by the World Anti-Doping Agency, WADA. Peptide therapy represents a cutting-edge approach to supporting health and longevity by enhancing natural biological processes rather than replacing them. From promoting growth hormone release to improving skin, immune, and cognitive function, peptides offer a broad range of potential benefits. However, the key to success is medical guidance, authenticity, and balance. When used responsibly and tailored to individual needs, peptide therapy can help restore vitality, accelerate healing, and support long-term wellness, bridging the gap between traditional medicine and modern bioregeneration. As always, reach out for more information about our health enhancement programs, including bioidentical hormone replacement and peptide therapy. Call 941-806-5511.